Hello, everyone. Welcome to Check Your Health and Maintain Your Wealth. Thank you so much for being here. If you're tuning on this video at the moment, you're all welcome. Thank you. So, we are going to look at reproductive health and look at these factors, those factors that if you need to conceive, you should consider them such that it aids you in conceiving, and those that if you want to conceive, you also try such that you can avoid in order for you to conceive. So we are going to be talking all of this together by looking at five major factors here. So if you're tuning in, you're welcome. Thank you so much. I'm your host, Tima Dauda, medical laboratory scientist at Tima Diagnostic Center and a reproductive health consultant. Thank you so much for being here. Let us begin this discussion in the name of the Almighty, most merciful, most glorious. May the peace of the Almighty be with you. May the peace of the Almighty guide you. May the peace of the Almighty have mercy upon you and myself and everyone else. Thank you so much for being here. So we are going to look at five major factors here that will affect you if you're trying to conceive. We all understand most ladies probably who got married during December will be trying to conceive in January, February, March, or maybe some may decide to postpone it. But if you decide to postpone or whatsoever, the most important thing is that you need to prepare before you even conceive. Conception is not all about you going straight to conceiving. You need to prepare in order for you to conceive. Reason for you preparing is as a result of the fact that you want your baby to be fine, because there are instances that you might get pregnant, and because of the lack of preparation before a pregnancy, what happens is that that baby have an issue. That baby might be delivered with birth defect. That baby might not even carry up to term. Remember, infertility in general has to deal with you not having your baby right up to 10. It might be that you have your baby just for maybe the first trimester because of one or two issues. So let us begin this discussion with talking about these five major factors. These factors are timing, age, weight, lifestyle, health, and medicals. These are the five major factors we're going to be looking at as we discuss this topic on reproductive health and how you can conceive whether a baby boy or a baby girl. Remember, if you look at this calendar year, you're going to see this is pregnancy. This is pregnancy from the first month right up to the 9th month. But for you to even achieve this pregnancy, you need to first of all prepare before you achieve this pregnancy, because pregnancy as a whole entails mental preparation, it entails financial preparation, it entails emotional preparation, it also entails physical preparation. So if you want to conceive, how ready are you mentally? How ready are you physically? How ready are you emotionally? How ready are you financially? And remember, medical preparation is the most, because if you have an issue medically, it will be difficult for you to conceive. So, talking about reproductive health, and if you want to conceive, the very first thing to think about is timing. Timing is having intercourse at the right time. So, if you're trying to conceive, then having intercourse at the right time is one of the most important things. And there are many factors if you want to conceive. Having intercourse at the right time will entail you understanding your menstrual cycle, will entail you understanding your cervical mucus, because the menstrual cycle is a key here telling you, oh, you ovulate on the 14th, or you ovulate on the 15th, or you ovulate on the 16th. Then your cervical mucus give you exactly what your system is telling you about. So if your system is telling you, oh, pregnancy will occur if you have intercourse on this specific day, or if you have intercourse on this specific day, then you look at the cervical mucus and you say, oh, come on, this cervical mucus is confirming the fact that I will get pregnant on the 14th, I will get pregnant on the 15th, I will get pregnant on the 16th. That is how timing comes to play. So timing is one of the most important factor if you want to conceive, as well as if you don't want to conceive. That's why we talk about reproductive health, because it entails everything. If you want to conceive, good. If you don't want to conceive, understanding timing as a whole also guides you as well. So the next thing is age. Age is actually one of the most age is the single most important factor that affects fertility, which therefore means that without any other thing, without any other factor, age alone will play a major factor here. Because with age, if let me say every other thing is fine medically and all the like birth, you are 50 years, obviously, it decreases your own chances of you conceiving, no matter you being fine other factors. Because as you grow older, you grow older with your eggs, the quality of your eggs changes, and the number of your eggs also reduces. So I will advise you, please, if you're trying to conceive, it is good that you try earlier. Do not delay it. The next factor is weight. Weight is a major factor here because if you're underweight, then conceiving might be difficult. If you're also overweight, then conceiving might be difficult. So, as a lady, as a man, if you want to conceive, as a lady, as a man, if you want to impregnate your wife, then make sure that the weight should also moderate on how your weight is, because overweight will affect the quality of the sperm, underweight will also affect quality of the sperm, overweight will affect your fertility as a lady, underweight will affect your fertility. How do you know you're underweight or overweight? To calculate your BMI by taking your weight divided by the square of your height. So if you take your weight, let's say your weight is 100 kilograms and your height is 2 meters. Square that 2 meters. What is square? Square is multiplying something by itself. So 2 times 2 gives you 4. So you take that weight 100 meters divided by that square, that is 100 divided by 4, you have 25. Now, once you do that, your weight divided by the square of your height, the answer you get, you take and you compare it with, you take this answer you get, you compare it with below 18, which therefore means that you're underweight, between 18 right up to 25, which therefore means your weight is okay, then above 25 right up to 30, it means you are overweight, and then above 30 means you're obese. So below 18, underweight, 25, 18 to 25, normal, 25 to 30, overweight, above 30, obese. So if you do like this, if you fall, then you moderate and you know how you can control your weight such that you improve on this fertility of yours. Reproductive health in general entails you understanding all of the knowing that this is the holistic way of you building your reproductive system, as well as giving more chances for you to conceive. Remember that if you don't want to conceive, timing is always the best way, which we have discussed already. The next factor that if you're trying to consult affect you is lifestyle. Lifestyle is very important because a lot of other factors that has to do with something medical, people pay attention to it and forget what they eat, forget what they drink. So under lifestyle, you moderate alcohol. Remember, alcohol in itself does not have any safe limit to your heart. Alcohol affects the heart, so there is no safe limit for people drinking alcohol in terms of the heart, because it is dangerous. For smoking, there is no safe limit if you're trying to conceive, so the best thing for you is to stop smoking. We have coffee. If you're trying to conceive, please cut down on coffee. We have folic acid. If you're trying to conceive, please make sure you take your daily folic acid. CDC even encourages all ladies who are already of reproductive age, it therefore means if you're starting menstruating, that you should go on folic acid, start taking folic acid once daily. This is gonna prepare you, protect you, such that it improves your fertility in future. Sister Stephanie, welcome. Thank you so much. How you doing? So if you can, on your lifestyle, if you can take your folic acid, you cut down on alcohol, you cut down on coffee, you cut down on smoking, you stop it completely, then you see that it is going to improve you, as well as exercises. Because a lot of us, we don't exercise. We don't exercise actually helps you to build your own cells and make sure that you can be healthy. Blood will circulate much more faster once you do frequent exercises. And with this, it builds your immune system, improves you generally, as well as improving your fertility. Sister Stephanie, hi, how you doing? Yes, breastfeeding mom can take folic acid as well, Sister Stephanie, because folic acid is first of all prescribed during pregnancy. It has no issue with breastfeeding mother. So as a breastfeeding mom, you can take your folic acid, Sister Stephanie. There's no problem. You can go on and take it. So it's okay. So congratulations to you. This one you're asking about breastfeeding mom. I believe that things have gone well to you on your side. Congratulations. I wish you the very best, sis. The next factor is health and medicals. Health and medicals here is actually one of the most, and this is where nearly everybody pay attention to. It is quite unfortunate that we pay attention to health and medicals and forget about all these other factors we may mention of that will affect you with your reproduction as you grow up. You forget about timing, you forget about your age that you're growing, you forget about your weight, you forget about lifestyle, and you're thinking, oh, I don't have chlamydia. Oh, my tubes are okay. Oh, my hormones are not fine. Yes, obviously, we all encourage that we should think about the medical part, but make sure you look about all the other things that will help you to build your reproductive system such that it improves your fertility as you grow as a lady. If you're a lady, you're 13 years old, 14 years old, 15 years old, and you started seeing your menses, understand that eating well, eating a balanced diet, avoiding alcohol, stopping smoking if you smoke, going on folic acid, all of this improves your fertility. Don't just wait until you're trying to conceive before you start working on it. Work on it right now. It is the best moment for you to start working on it. So under health and medicals, we have hormones, we have STIs, we have endometriosis, we have polycystic ovary syndrome. All of these are all things that will affect you under health and medicals. And infections, there are many infections that can affect you. We have chlamydia, gonorrhea, or mycoplasma. These are all infections that can affect you. Under endometriosis, under polycystic ovary syndrome, these are all things that you should think if you are trying to conceive birth. Under health and medical, this is something you should talk with your doctor. Your doctor should follow you up and know exactly what could be the problem. Because if any of this is an issue, maybe you have an STI, maybe you have a disease situation, maybe you have polycystic ovary syndrome, that's PCOS, maybe you are suffering from endometriosis. All of these, your doctor should be the one to look at it. Or maybe you may have fibroid, you might have other cysts that are disturbing your ovaries, like the ovarian cyst. Then your doctor should be the one to tell you, oh, come on, this is an issue here, it should be sorted. Please avoid assumption that you have this thing whereas you don't have it. As a young lady growing up, you should also try to do this checkup as time goes on. Understand that miscarriage is an issue with fertility in the sense that you might conceive and you have a miscarriage. So, trying to take care of all of these will also avoid miscarriage in future, because something like your blood group as a lady, it might also lead you to miscarriage. There are blood groups, like if you're a rhesus negative lady, your blood group, if your partner is rhesus positive, it is possible that you might conceive and you have a miscarriage because maybe you have had a pregnancy before, or a miscarriage before, or an abortion before. So all of this should be taken into consideration. I encourage you to go through it. If you're coming on a video, please, for the very first time, don't forget to click on the red subscribe button and subscribe to our YouTube channel. Check it out and maintain your work. Go through this video. If you have a question, please don't always hesitate. Make sure you send us a message, a WhatsApp message on 00237 666 006107. You can also Keep us a comment. Let us know where maybe we are lagging, or where you maybe you not understood, such that we can clarify you, as well as let us understand your question so that we can answer it directly. Thank you so much. May God bless you. Do have a wonderful time. Please keep safe and keep your family safe. May God bless you. Have a wonderful time. Thank you.